unfamiliar. They're not going to go where the doctors and physicians may not even look like them and may not even get them. So this tells you how powerful trust is, and that these women would have their babies in the place that's rat infested just because it's familiar. They were born in that hospital, their families were born in that hospital, their mom was born there. That is where they go. That's very comfortable. So I mean, this is the importance. So what we're going to learn about today is basically trying to understand what these health disparities are, why it's important to understand what that is. Tennessee, woo! Did some little bit of research on maternal health in Tennessee. I was basically really kind of moved by what I saw and thinking, gosh, talks like this is just so important because you guys have your hands full from what I'm seeing, from where I'm sitting. I do want us, we need to understand and recognize what trauma looks like in patients, how it's presented, and be able to just get an understanding of that. And then we also want to talk about mindfulness. And I'm all about meditation and mindfulness, how we can infuse that into trauma-informed care. That's a buzzword now. Everybody wants to be trauma-informed, and everybody has their own definitions. I have my own perspective and how I use it in my practice. And then I'm interested in you guys. Like, what are you all doing for self-care? Like, you're not going to be able to show up in the mindful way with your patients, if you are not incorporating all of this. My goal in life, honestly, is if I could have the world reflect all of the things that I hold valuable. I want all of us to be compassionate. I would love for the entire world to be mindful and to be not as reactive and not and really having love in everything that we do. That's the kind of world I want to live in. That's the kind of world that I want to have. So that's what I'm going to talk about today. It gets into mindfulness. And there's handouts. I do have a handout. I sent it over to Angie and some other people. It's a doc. So you could go in there and you could type in your notes, because if you're at your computers, you may want to jot something down or type something in your notes. I did, by the way, on last Friday, I did a version of this. It's a little bit different with the care managers, with the Nashville Strong Babies, the care managers. I did a version of this, and I recorded it on YouTube because it took me so long to put all of it together, and I ran out of time. So maybe I'm gonna copy the link to it. I'm gonna drop the link into the chat. It's my YouTube channel, but I'm gonna drop it into the chat in case somebody wants to later on. I see if everybody can see that later on. Take a look at what the care managers, these are the people that are on the front lines working with a lot of the patients, a lot of the women that you guys also see, but from a different perspective. But they had concerns and they had ideas and challenges, unique challenges that they're up against. And so if you want to, I put the link in the chat. I encourage you to take a look at it. It's a long video that I did. And so I think it'd also be helpful for us today. Okay. So let's talk about what the disparities are. Um, these statistics, boy, paint a really stark, I think looking at these numbers, it's a very urgent picture of maternal health disparities, particularly in Tennessee. Um, oh gosh, like the maternal mortality rate is 41 deaths per 1,000. It's the highest in the nation, one of the highest in the nation, double that of the national average. I think this is a crisis, honestly. It looks at some of the systemic challenges that I will talk about in later slides, but it looks like Black women in Tennessee are twice as likely to die from a pregnancy-related cause compared to their white counterparts. And I think this mirrors the national trends in a lot of ways. But it's not just biological differences. It's rooted, I think, in structural inequities,